Hello everyone, I'm Gurkeerat Kaur, Assistant Professor at SSD College Barnala. Students, today we are going to learn about disability studies. So, first of all, we are going to learn about what is disability. Disability means a condition that makes it difficult for a person to perform some certain activities or interact fully with the surroundings in the same way as others. So, in simple language, we can say disability is not something rare. It is a part of human life. Around 1.3 billion people in the world live with the form of disability. Disability does not only come from a person's health condition, but also from the environment around them. For example, if there is no ramp for the wheelchair, the problem is just not the person, but also the environment. Impairment versus disability versus handicap. So what is impairment? Any loss or abnormality of body structure or the function, which can be physical, mental, or sensory. For example, loss of leg or brain injury or hearing loss. So what is disability? We have discussed this one before. So disability is the restriction in performing the activities due to an impairment. For example, difficulty in walking, speaking, or learning. What is handicap? Handicap is social disadvantage faced by a person because of impairment or the disability. Example, inability to get a job due to lack of ramp or the sport. In simple words, we can say impairment is problem in the body or the mind. Disability, difficulty in doing the activities. Handicap, difficulty in participating in the society, right? So we will move forward to the next slide. RPWD 2016. It means Rights of Persons with Disabilities Act 2016. It recognizes 21 types of disabilities, which we are going to discuss further. Next, a person with 40% or more disability is called as benchmark disability, which includes physical disabilities, intellectual disabilities, mental disabilities, and neurological disabilities. This law protects the rights and equality of people with disabilities. Next, physical disabilities. First is locomotor disabilities, afflictions of musculoskeletal or nervous system, which creates difficulty in the movement. Second, leprosy cured, loss of sensation or physical deformity, which affects body control. Dwarfism, adult height of 4'10", which is also known as 147 centimeter, short height. Muscular dystrophy, which means muscle weakness. Sorry, we left with the 1 point cerebral palsy, which means non-progressive neurological condition affecting movement. These all five types will become in physical disabilities in the Act 2016. Next, sensory impairments. First one is blindness. Total absent of sight or visual acuity less than 3 by 60, which means blindness who cannot see. Low vision, visual acuity between 6 by 18 and 3 by 60, limited vision. Next is hearing impairment, deaf, 70 dB loss in both ears. Second, hard of hearing, 60 to 70 dB loss. Hard of hearing means partial hearing loss in the person. Intellectual and mental disabilities. First one is specific learning disabilities, deficit in processing language. For example, dyslexia, dysgraphia. So, what do you understand by dyslexia? Dyslexia means that person, that child who is having difficulty in reading. And what do you understand by dysgraphia? A child who is having problem in writing. Dyscalculia, difficulty in maths. and dyspraxia, difficulty in motor development. Next one is autism spectrum disorder, ASD, which affects communication and the social relationships. Next, mental illness, disorder of thinking, mood, or perception that impairs the judgment. Basically, it affects mood and thinking. Some students may learn difficulty and need stress support, right? So, next is chronic and blood disorders. First is chronic neurological, multiple sclerosis, and Parkinson diseases. These are long term health conditions. In Parkinson disease, it affects movements. Okay, and in multiple sclerosis, there are hemophilia, in which blood does not clot properly, thalassemia, low hemoglobin, and sickle cell disease causes anemia and the weakness, and they affect in tissues, right? So the next one is early identification and intervention. This is very important topic. Early years are very crucial for survival and the development. Identifying problems early helps improvement, right? Early identification prevents developmental risks and enhances success. There is a major role of special educators. They help in design IEPs, which is individual education plans, which conducts assessments and deliver remedial programs. So, last but not the least, digital interventions benefits personalized learning, improved communication, and increased independence. Technology is helping people with disabilities a lot. For example, assistive tech, which helps for screen reading for the blind students. Next, mobile apps. There are many nowadays. There are many mobile apps. For example, I have mentioned one, Autospark, which is the best one. Last, virtual reality and robot assisted therapy. Technology makes learning easier and more independent. In the conclusion, I would like to say disability is not an inability. With the right support, environment, and the understanding, every person can live a full and meaningful life. Thank you for your attention, students. See you in the next video. And don't forget to like and subscribe our YouTube channel. Thank you.